The upper neck region is the structurally weakest area in the spine because it is so mobile. Most of the other spinal segments are locked together. But it's also an area that houses and protects your nervous system. It's what allows the brain to fire electrical impulses down to the organs in the body, keeping that tissue healthy. And it also has a pathway where those signals can be sent back up to the brain to give it a status report. So generally speaking, if that cycle can be kept intact, that can keep the body very healthy. The challenge we run into is your head weighs 7 to 13 pounds. When 3 different things can happen to you, they can traumatize the neck. Most commonly is physical trauma, and that can be macro trauma, where you hit your head in a tree branch or tumble down the steps or get whiplashed. But it can also be micro trauma, where you're sitting at a desk too long or sleeping in bed with 3 pillows underneath your neck, and that can cause that segment to dislodge. There's chemical trauma, which would be like food poisoning, overdoses of drugs, anything that tends to almost act like grabbing onto a bare electrical wire. And then there's emotional trauma. The head, again, weighing about 10 pounds. When you're under emotional stress, the muscles pulling down on the skull can make it 3 or 4 times its normal weight, making the neck very vulnerable towards dislodging. In the work that we do, we precisely take a look at the size and shape of the joints, determine exactly how the bones displace within millimeters, and then very precisely reposition the segments back in place. If we're lucky, we get somebody right after they've been traumatized. But oftentimes, by the time we see a patient, they've had 5 layers of injuries, and they've been trying to drug the problems to resolve them when the actual injury was never fixed. So our objective is to precisely realign the head and neck, allow the nervous system to awaken those nerves, and try to get that body as close to where it was before it was injured.